I would say Nigeria is a priority country for the Gates Foundation. It's a priority country for most of our program strategy team, MNCH, nutrition, family planning, vaccine delivery, you name it, policy advocacy, all of those teams have Nigeria as a priority. And they've been making investment over the past years to support key priorities in Nigeria, both at the federal and at the state level. But when those investments land at the in Nigeria, especially at the state level, there is a fragmentation of effort, and the government didn't really have most of the time clear visibility in terms of what support from the Gates Foundation was doing. What it was, sometimes really supply driven, but not demand driven. And in 2016, the Gates Foundation decided that one of the ways to solve for that problem was really to, bring leadership at the country level. This is why in 2017, a director was appointed. I was asked to go and, start building a team in Nigeria to work very closely with our teams in Seattle and start thinking about a different way of doing business and working very closely with the team, brainstorming with them, and also with our partners. We were able to propose this concept, which is still a work in progress.
Well, in 2017, the Gates Foundation shifted its advocacy country office in Nigeria to be more programs focused. And that meant shifting the management, the day-to-day work from Seattle to Abuja. And so as we hired program officers in country and expanded the office, it became clear that we needed to really coordinate our PHC investments at the state level in a much more centralized way, as one government staff put it, to help BMGF go under one roof. So that was one of the driving factors. Another thing was that we saw a persistent issue at the state level, where a lot of the investments that came from donors were very donor-driven, not necessarily responding to the gaps that you saw in the AOP or strategic plans that states had, or not necessarily at the request of states. And so it was intended to really resolve these two persistent issues within BMGF and the donor community at large.
The Gates Foundation supports improvements in health and productivity of people around the world, working through collaborative partnerships with government, non-government organizations, academia, and private sector. In Nigeria, one area of focus is to strengthen and enable systems to deliver primary healthcare services. And in Nigeria, state governments are a critical stakeholder in PHC delivery. And so as a grant-making organization, the foundation seeks, more cohesion in its PHC support to state governments. And so the Technical Assistance Hub, the TA Hub, is being conceptualized to be a platform agile and responsive to state needs, and to offer opportunities, to present opportunities to co-create with states as they embark on transformations that strengthen and enable their systems to deliver services for maternal and newborn care, for routine immunization, for family planning, for malaria, and for nutrition.
I would say we describe ourselves at the Gates Foundation as impatient optimists. People want to go and solve problems, and they want to move fast, and they want to move effectively. There was a big challenge to, ask people to pause a little bit, to really change, adapt this change management and, mindset shift to say, there is a way that we can articulate the problem along with the government, and then also hear from the government, especially at the state level, what kind of support they need, so that we can propose those solutions better. And we need to bring the solutions close to the state government so that they have access to those solutions, very quickly in a more predictable way. Not that we need to spend a lot of time designing the solution from them. That was, a big challenge. Also to articulate to our program strategic team that, this approach will continue to provide value to the work that they're doing. Now, on the side of our grantees, the traditional grantees that have been really doing the work of providing tea to the government there, they've been doing that work very well. But really, having them come together to realize that they needed to collaborate and contribute and discuss was so instrumental for this to happen. I recall, having a very frank discussion with 3 CEO of one of our key implementing partner grantees to really discuss and brainstorm with them for us to co-design this engagement, along with our program officers as well, who are in the forefront really making this grant happen as well. So those were for me some of the key considerations.
I'll answer that with 2 different aspects. One is the internal, and I think that internally and externally change management is difficult. And so internally it was really working with our program support teams to assure them that what we were doing would also meet their specific vertical or programmatic target needs, that we wouldn't, for lack of a better word, over-integrate. It was about smart integration. It was about looking at how to build systems, but not forgetting critical areas of PhD services. And so getting the program support teams to buy into and align on the TA Hub was a challenge. And then this externally, I think another challenge for the change management was that we were undergoing a lot of different changes at that time. Shifting from advocacy to a programs office meant a new country director, new leadership, new deputy directors, a whole new slew of program officers, grantees unsure of what the future held for the country strategy, what direction we were going to go philosophically with PHC. And so during a very uncertain time, to bring a major centralized TA Hub mechanism into place was a little bit of, it caused a little bit of angst with all parties, internally and externally. And I think especially our traditional go-to PhD grantees felt this angst particularly because we had a number of investments with them that they weren't sure about what's the next step after that. So I think those were some of the biggest critical considerations of how do we think about building the train on the tracks as we go, and really thinking about just-in-time changes that we knew would have to take place.
In actualizing the concept of the Technical Assistance Hub, there were a number of critical considerations. A few were that, we needed to embark on multiple stakeholder consultations to get, diverse views on what the value add would be of the TA Hub. And so in getting views of stakeholders, it was important that we understood what the resonating issues or concerns were and build consensus around what the value add of the TA Hub would be. And then once we're able to do this, it was important to do change management, because this would be a different way of doing things from the foundation's perspective. And so we needed to manage change. Importantly also, it was important that we got stakeholders to understand that the work of the TA Hub would be complementary to the work that they're already doing, the work that's already on the way. And to certain organizations, it was important that we conveyed that this was not to be viewed as a competition, it was complementary.
That's a very hard question, because I think we started with a vision that evolved over time. Like all good ideas, we were very open to seeing what happened and then collectively agreeing or disagreeing on how to make tweaks and adjustments.
The launch of the TA Hub idea happened when a number of prerequisites were in place already. There was already a team in Nigeria. First of all, I'll say a mandate by the foundation to the Nigeria country office to really rethink the way we do business in Nigeria. We had in place, teams. We had a, policy advocacy, deputy director in place, and we had an expanded health team led by a deputy director, health and nutrition, Dr. Caroline Apia, was in place, and we had a number of SPOs, Charity, Jenny, and Yusuf, and others were, doing really great work there. And we were starting to look at how we can bring our health and nutrition work together, especially as we think about engaging more on primary health care, health system strengthening, and bringing both the health system strengthening component with the service delivery component, together. And then something happened was that we had in our pipeline an investment to provide a TA to the Kaduna and Kano state to do some work on performance management, and starting with Kaduna. And we decided that it was maybe a good idea, to do an RFP, request for proposal, and we sent that RFP to a number of key partners. I remember 6 of them. And then when the application came back, and when we were reviewing those applications, we really realized one thing. It was really striking to see how, at least 3 of the 6 partners, they all had, capacity to do the work, but in their proposal, they had different strengths that were different from each other. And we realized that if they were brought together to kind of like come up with one proposal, it would be even a very strong proposal. But then during that discussion, we started, discussing the fact that, maybe we need to start now taking this as an opportunity to rethink the way we provide TA to the government and to the government. So that because taking a lot of money for a long time, locking it to one grantee, it makes difficult, for grantees to engage and collaborate because they have their, way of working at the national and state level, etc. So that discussion started there, and we, called all those grantees together and we started discussing. This is how, we gave them a mandate. We agree with them that, if you can go and then help us think about the way we should restructure the way we provide TA to the government, I think that will really be very beneficial. And this is how it started up to, as later on, bringing in DAI, to the incubation of TAConnect. This is where we are now.
So the concept really started maybe in 2015 with this idea of that BMGF under one roof, needing to have our various PhD program teams coordinate better, work in alignment better at the state level, particularly at the state level. And out of that 2015 concept of really doing things in a more integrated, coordinated way, and the evolution of the country office in 2017, I think this idea, when it emerged in 2018, was felt by many that it's time to do this, but we don't know what it is. What will the TA Hub look like? What will it become? How will it evolve? What does it mean to have a grant as the hub versus sub-grantees? So lots of things were going on in terms of how to evolve that concept. We started off with 3 key organizations helping to brainstorm and come up with some of the nuts and bolts of how that independent hub might look. And then a lot of things came out of that, lots of great discussions, lots of hard discussions. And I think that the evolution after that was, how do we then bring in the ideas across management concepts, across service delivery concepts, and build a hub that's able to meet the needs not just of BMGF but other donors as well, and design something that is independent and able to operate to support the many needs across the states, particularly that BMGF is focusing on. So I wouldn't say it's even the design phase is still undergoing some tweaks and edits, and it will continue to do so. I think the way that the foundation works, we allow a lot of malleability to things, which is sometimes uncomfortable and sometimes very comfortable. So I think it's an ongoing story.
So in moving the TA Hub from concept to design phase, the foundation partnered with 3 organizations, CHAI, Solina, and HSDF, to develop design features. And so these 3 organizations embarked on information gathering and iterative consultative exercises. Now, following the submission of these design features to the foundation, we now entered into partnership with DAI Nigeria to incubate this hub and to use the design features to establish a steady state hub that would be local, independent, and named TAConnect. And of course, we give them the flexibility to modify elements of these design features, within reason and with rationale. And so that work is underway. DAI Nigeria is serving as interim managers of the hub, And in fact, as we speak, there are deployments on the way to states in support of their PHC agenda. And so with all that is going on, look at it as us partnering with DAI to build the ship and to sail the ship at the same time.
Well, my aspiration for the TA Hub for the next 5 years, and that one, that the TA Hub and then the TAConnect is established as a credible organization in the face of the state, where they can, access specific TA around primary healthcare, different primary healthcare component, where they can trust the TA Hub to provide capacity building and not capacity filling support. And the second is that also the TAConnect continue to earn the credibility and respect of different strategic priority team across the foundation, so that those strategic team, let's say malaria and family planning, MNCH, and global development, GDP, the global delivery program, continue to see the value to request TA through the TAConnect, to achieve their Nigerian goal. So that will really mean that the TA Hub focuses on the mission. And then the third is really to see other donors also see value in investing money to the TA, so that to the TA Hub, so that the TA Hub can also facilitate the TA provision to the state. And finally, for them to sustain and start thinking about approaching other sectors as well, apart from primary healthcare component, but also looking at other area where they can provide TA to the state.
Good question. I think currently, the original vision was that the TA Hub would be something that multiple donors could go to, so not just something that BMGF uses, but other donors as well. And it's a stabilized entity, not overly dependent on any one donor, but having a robust funding source. But also, I think, ultimately able to respond to state needs and states actually requesting TA support based out of their AOP process or their strategic development health plans, but really coming more and more from the states. We know it'll take a few years before that concept comes through, but doing more bottom-up and responding to state needs. And then in the next 5 years, of course, hoping that the TA Hub doesn't just only focus on PHC, but is able to respond to state needs across the spectrum of human capital development.
So thinking ahead, in 5 years' time, we envision that TAConnect is fully operational as a local, independent entity that is recognized as a trusted source of technical assistance for PHC support to states, that is known as a platform that can facilitate scale of proven interventions that can improve coverage and uptake of essential services, that is known as a platform that can be leveraged by local organizations in Nigeria to improve their visibility and to amplify their skills in service to states, and that is known as an organization, a platform that can, add to public knowledge by generating, public goods that, are all relevant to PHC system strengthening. So all in all, we envision that, TAConnect and that TAConnect's engagement with states will result in, transformations that strengthen their PHC systems to enable delivery of essential services for maternal and newborn health, for routine immunization, for family planning, for malaria, and for nutrition.
The Technical Assistance Hub is a brilliant approach to re-engineering the way that technical assistance is delivered to beneficiary state governments. It initially focused on strengthening primary healthcare systems and building the capability and capacity of government officials that operate those primary healthcare systems. It also tries to improve the uptake of group antenatal care in pregnant women, as well as reduce the incidence of malaria in pregnancy. Additionally, it focuses on reproductive, maternal, child, adolescent health, as well as nutrition. The TA Hub provides an independent interface between donors, beneficiary governments, and TA providers. The Hub doesn't implement by itself. It facilitates the provision of high-quality technical assistance using available funds both from donors and governments in an optimal way. In doing so, it provides an opportunity for local technical assistance providers to contribute to the improvement of primary health care in the country. It also helps to build their capability and pairs them with international service providers so that they can work jointly to provide the best technical assistance possible. DAI has had to sail the TA Hub ship while building it. In doing so, we have leveraged the other useful grants that the BMGF has already given, such as incorporating the reimagining TA principles, drawing on the learning from the responsive feedback mechanism approach, through which you constantly get feedback and infuse that into project delivery, and also the inclusion of implementation research as a means of calibrating the technical assistance that is being delivered. All of this has meant that we've been able to employ an adaptive management approach to constantly doing and constantly learning. This has meant that we have been able to deepen the involvement of our beneficiary state governments, as well as build the capacity of local service providers, at the same time drawing on the vast array of knowledge and expertise within the BMGF family. DAI is absolutely delighted to have been part of incubating this really exciting initiative.